When the cesarean is performed, you have to weigh the pros and cons of the procedure. This also involves having a glimpse of the added benefits, as well as the risks of going a cesarean operation for giving birth to a child. Sometimes the merits of this exercise more than offset the risks of the exercise and give soothing comfort to the offspring in a systematic manner. But normal births are more advantageous without anything said against it. Cesarean section child-induced. This is major surgery in spite of the fact of advancement of medical science. Risks are prevalent. The estimated risk of death after a normal birth is less than 1 in 10,000 as against 2,500 in the case of cesarean surgeries. There are a lot of estimated risks for a majority of sections of women population. Some medical conditions, such as cardiac problems, expose the risk of normal births, which are a degree superior to the cesarean births. Under such circumstances, normal births are more risky. Cesarean section information. There are a lot of risks for the baby, such as breathing problems, premature birth, fetal injury, low Apgar scores, affecting anesthesia levels, which are attendant problems and risks for a baby during the birth time. Sometimes there are risks for mother also, which can be enumerated in the following paragraphs. These risks are increased blood loss, infection, decreased bowel function, longer medical stay, and risks due to additional surgeries, respiratory complications, blood clots, reactions to anesthesia, as well as injury on the bladder or bowel, are the various risks involved for mothers, which need to be taken care of at the time of surgery. With all cesarean section stitches the precautions intact, with all the technologies involved, for the purposes of tackling this critical situation. If all these precautions are taken, this surgery is considered relatively very safe. In spite of more complications it involves at the time of delivery. Your recovery time is more prolonged than a normal delivery. The most universal complications for the mother are outlined below. These involve maternal death, heavy blood loss, infection, nausea and vomiting, severe headache after the delivery, as well as blood clot in a vein. These complications may have to be counterbalanced by way of taking further precautions in times of surgery and its aftermath, after taking into account all the medical technologies available, vis-a-vis all the complications for arriving at a balanced approach. There are certain risks which affect the infants also, such as lung immaturity, neonatal care, as well as getting bruised up during the delivery. These risks have to be carefully controlled at the time of birth, with the expertise of gynecologists, as well as advancement in medical sciences. Most women recover from these births even without complications. The only word of caution is that this has to give more time for convalescence, for getting all the incisions or scars to heal up eventually. There are a lot of risks involved in these cesarean sections, but with the expertise of doctors as well as advancement in medical sciences and facilities available in hospitals for mitigating risks, these can be combated successfully to add an feather on the cap of medical sciences.